Hello, good morning. Today I'm going to present a video case presentation entitled Endoscopic Ultrasound Choledochoduodenostomy as Salvage Therapy for Failed ERCP in Malignant Biliary Obstruction. This was a case of 75 years old female diagnosed with stage 4 bladder cancer that metastasized to vertebrae and also distal bile duct. In here, shown there are dilatation of the common bile duct or the distal part 20 millimeters, and we can see that there are some part of the vertebra which has the metastasized nodule. The ERCP cannulation for this patient was attempted, however it is failed. This is the procedure that was done on this patient. At first the cannulation was performed and the wire entered the pancreatic duct. And then we put some pancreatic stent, 5 franc, and also the cannulation was performed. However, there are some difficulties, so salvage therapy was proceeded with the EUS biliary drainage. An EUS with a linear probe was used, and then we visualize a mass which size about 22 millimeters. Identification of the common bile duct was then performed by using the Doppler ultrasound. And then we can see that this Doppler negative bile duct, we then do the puncture, and the puncture was then performed and the aspirated bile fluid was obtained. We entered the guide wire to the dilated common bile duct. We entered the dilated bile duct under the guidance of fluoroscopy. We do the insertion of the needle knife and also a 6 millimeter hurricane balloon to enlarge the needle track, the puncture track. And then we can see here that from the wire insertion, it goes into the track, and then we dilate the hurricane balloon. After the dilation, and then the bile gush out from the point of insertion, and then we do the stent metal insertion. The stent metal was deployed with the first end positioned below the hilum and the second end approximately 1.5 cm at the duodenum. After the stent was fully deployed, a significant amount of bile flowed out, and then we can see in this image that the bile flows out from the metal stent which has been put inside. Then the clip applied at the edge of the stent to ensure the stability of the metal stent. After show at the fluoroscope that the stent has been fully deployed and in the correct position, we then do the irrigation on the duodenum. We can see here that from the bilirubin, it quite decreased from 20 until 5 at the third day of the procedure. So we conclude that the EUS-CDS is a salvage option for failed ERCP with a high rate of technical and clinical success and low risk of complications. Thank you.